In this video, I'm going to show you how you can drastically lower that constantly high blood sugar level and start feeling healthier, stronger, and more energetic. By the end of this video, you're going to have an easy step-by-step process for dropping your high glucose levels. I'm going to explain to you what foods to eat and what foods to avoid, when to eat, and how much to eat. But if you stick around to the end, I'm also going to share with you a secret bonus. Getting diagnosed with type 2 diabetes can feel overwhelming. It affects your body and changes how you live your life. You've probably seen people with diabetes struggle, like numb hands and feet and infections, amputations, even serious issues like kidney and liver problems and premature death. It's pretty scary. After the diagnosis, a lot of doctors don't even explain what you can do beyond taking the medications like metformin. You're left wondering, well, how can I get back to normal? Can I reverse this? What should I eat? Is it possible to stop taking these medications? Well, I'm going to tell you what I did to drop my A1C from 9.3 to 5.4. I lost 70 pounds without exercise, and I lowered my blood pressure in 3 months with only lifestyle changes. So I'm not a medical doctor, and neither am I providing medical advice here. I'm simply providing you with a proven clinical method that was developed by a medical clinical doctor named Dr. Eric Westman. You can check him out on YouTube if you want more information. So me personally, I was prescribed metformin when I was first diagnosed with type 2 diabetes, 1500 milligram tablets to be taken twice a day with food. But I started following this process while taking the metformin, and I stopped taking it about 2 weeks into the diet without telling my doctor. Please don't do this. Make sure that if you're going to follow this, that you get your doctor to go on board with you, so that way you guys can monitor your health and see if there's any negative things happening, so that way you're safe. But what I'm about to share is going to drastically lower your blood sugar levels, and if you're taking metformin, your sugar levels can drop to pretty dangerous levels. The first thing is we're going to look at Dr. Eric Westman's famous page 4 food list, which is no sugar, no starch. We want to stay to the foods in this, and we want to keep the dietary carbohydrates to less than 20 total grams per day, not per meal, not net carbs, but total grams per day. And if you stay to the list, you're not going to need to count the carbs because it's going to keep you under 20 grams per day. It doesn't matter how the food's cooked, just make sure there's no coating, and you want to make sure that you're drinking zero carb liquids. When you're hungry, you can eat as much as you want of these foods. So here we go, until you're comfortably full. So we can have beef, like hamburger, steak, pork, ham, bacon, lamb, sausage, pepperoni, hot dogs, and other meats. For poultry, that's going to be chicken, turkey, duck, or other fowl. Fish and shellfish. You can have any fish like tuna, salmon, catfish, tilapia, trout, shrimp, scallops, crab, and lobster. And have eggs, whole eggs, including yolks and whites. And the next thing, we want to have a limited amount of salad greens and non-starchy vegetables every day. So you want to have at least, but no more than 2 cups of leafy greens, uncooked, and when they're measured. So you want to make sure you're measuring out 2 cups of uncooked leafy greens a day. So that would include bok choy, cabbage, chards, chives, greens, collard greens, mustard, and turnip greens, like kale, lettuce, any variety, parsley, spinach, radishes, scallions, and watercress. Basically, if it's a leaf, you can eat it. And then as far as the non-starchy vegetables, you don't want to eat more than 1 cup, measured uncooked a day, which would include like artichokes, asparagus, broccoli, Brussels sprouts, cauliflower, celery, cucumber, eggplant, green beans, string beans, leeks, mushrooms, okra, onions, peppers, pumpkin, rhubarb, shallots, snow peas, sprouts, summer squash, tomatoes, wax beans, and zucchini. During the first few days, some people, but not everybody, may experience something called a keto flu. So what that means is you might experience headaches and tiredness, maybe some brain fog. Your body is changing metabolisms. You're going from a high carb diet to basically a high fat, protein, low carb diet. And because of that, your body's going to start dumping out water, because when you eat carbs, your body holds a lot of water retention. Especially if you're diabetic, you notice you get swollen ankles, you get swollen wrists, swollen body parts. Is because of the water retention, because of all the carbs. So when you're transitioning from the different metabolisms to, you're gonna be dumping out all that excess water that your body's been holding on to. And you may even see within your first week to 2 weeks, you may lose 15 to 20 pounds, but most of it's just going to be water weight. And also, to reduce your chances of this keto flu, make sure you drink when you're thirsty, and you can use bouillon. Bouillon dissolves in hot water. You could do that twice a day for some sodium, for replenishment. If you have high blood pressure or heart failure problems, Dr. Eric Westman says don't use bouillon. You can have cheese. You want to have up to only 4 ounces a day. And that'll include like hard aged cheeses like Swiss and cheddar, mozzarella, cream cheese, goat cheese. But make sure you're always checking the carbohydrate count on the back, and check your servings. Make sure that the serving and the carbohydrate count is realistic. You can have mayonnaise. You can have up to 2 tablespoons a day. Cream and oils, up to 2 tablespoons a day. That would include butter, half and half, whipping cream, light cream, sour cream. And you can have as many zero carb snacks as much as you want. That would include sugar-free Jell-O, pork rinds, pepperoni slices, low-carb jerky, boiled eggs. You can also take a multivitamin without iron, unless your doctor recommends that you take iron. But I like to take electrolytes like magnesium and potassium. Going on this diet, you might have like muscle cramps. You may wake up in the middle of the night and your legs just kind of cramp out of nowhere. That's because you need electrolyte. And what you want to avoid now is basically anything that's not on the list. When do I eat? So basically, you want to eat once a day, ideally, because every time you eat, it raises your insulin. Type 2 diabetes is sometimes called insulin resistance, which means that you build up a tolerance to insulin. So insulin aids in lowering the blood sugar levels after eating a meal, but if you're not responding to that insulin, your sugar is going to skyrocket and it's going to stay elevated for longer periods of time. This is what type 2 diabetes is. It's high glucose blood sugar that's been elevated, and it's elevated because the insulin is not reducing it. So basically, that's like how much sugar is in your body. And that's measured by what's called an A1C test. So when you go to your doctor, you look at your blood results, that's the doctor looks at that number, and that's what he determines if you're diabetic. So basically, by eating once a day, you're giving your body a chance to build sensitivity to the insulin. So that way, when you do eat carbs, the insulin will respond and bring that sugar level down quicker. So how much do you eat? Well, you can eat as much beef, chicken, fish, pork as you want, and you can just make sure you eat until you're comfortably full. Some people do maybe like twice a day. They eat in the morning and then maybe like lunch, and then they skip dinner, and then they go to sleep, and then they have that long fasting, that intermittent fasting period that gives their body a chance to, their pancreas a chance to stop producing insulin. So now the moment you guys have probably been waiting for, I'm going to share with you the bonus now. So basically, keeping your carbs to 20 grams total per day not only reverses type 2 diabetes and lowers your blood sugar, but it also causes you to lose weight, like super fast. Also, this diet is likely to cause some people to argue and comment and say carbs are required. What about high cholesterol and fat is bad for you? Well, I'm not going to go into these details here, but if you're interested, I can make a video talking more in depth about those topics and why they're myths and founded on bad science. New research is starting to suggest that high fat is actually good for us. I know this diet can sound hard for some people, but if you just drastically cut your carbs, you're going to see results, and you're going to feel healthier, younger, and you're going to have more energy, and you're going to lose weight, and you're going to get your life back. If you're interested in more information on the ketogenic diet, I would check out Dr. Eric Westman's YouTube channel. I'd also recommend Dr. Ken Berry and Beat Diabetes with Dennis Pollock, and those are really good resources. So thanks for watching.